It is time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up this week, an important development in the fight against heart disease. We know that lowering cholesterol helps, but John, how low should it go?
Vanita, the new report looks at an alternative treatment using the drug Zetia. Combining it with statins could reduce the risk of heart problems.
The study may change the way doctors treat patients with heart attacks or severe chest pain. Dr. Chris Cannon of Brigham and Women's Hospital presented the findings at a meeting of the American Heart Association.
We see benefits of taking cholesterol levels that are low to very low in the post-heart attack patients.
More than 18,000 patients who had either a heart attack or chest pain were treated. Half received a high-dose statin and half received Vytorin, which combines a statin with another drug that decreases cholesterol absorption. Statin alone lowered the bad cholesterol, or LDL, to an average of 69. Vytorin dropped it to an average of 54. After 7 years, the Vytorin group had 6.4% fewer cardiovascular events, such as death, heart attack, and stroke. 1 year ago, new cardiology guidelines suggested doctors stop targeting specific LDL levels because there was no good evidence one low level was better than another. Dr. Steve Nissen of the Cleveland Clinic believes those recommendations need to be changed immediately.
This study really does blow up the guidelines. I mean, the guidelines didn't have target levels for LDL cholesterol. And many of us thought that was wrong. And now, within a year of issuing the guidelines, we know that that's wrong.
So, John, in the piece there, you looked at a specific drug. Do we know, is that the best way to lower cholesterol?
We don't know that at all. And in fact, there are some new drugs that are a little bit better, new statins that are better at lowering the LDL, the bad cholesterol, than, say, some of the older statins. And there are also some experimental drugs that are being looked at that lower the LDL. So this is interesting because it says that going from an LDL, which is a very low level of 69, going down to 54 makes a difference. Now, the question is, what's the best way to get it down there?
So what are the implications now then, John?
Well, some cardiologists say you can't go too low. You can't be too thin or too rich, and you can't have an LDL that's too low. We don't really know how low is too low, or if there is a too low.
Right.
We know that 54 is better than 69. Is it better to go even lower than that? And we have to do more studies to see, is it safe to do that? Are there side effects from doing that? And do you keep getting a benefit from doing that?
All right. A new study out of Vanderbilt University has more evidence that a large number of breast cancer patients choose mastectomy over lumpectomy, even when the conservation surgery is effective and recommended by their doctors. Holly, tell us about this study.
Yeah, I think this was a very interesting and large study. The biggest point they made was that over an 8-year period, the number of women who could have had a lumpectomy, which is a much smaller surgery for their cancer, actually opted for a mastectomy. The number increased by 34%. A mastectomy is total removal of the breast. And in some cases, women even chose a double mastectomy, removing a breast that hadn't even been affected by cancer yet. What was interesting about this study, though, is that the women were fully informed that by doing the larger surgery, they weren't necessarily lowering their risks of getting cancer.
So if they were fully informed, why then are they picking the more invasive surgery?
You know, it's an interesting question, and John and I were just talking about it. I find in my practice a lot of women really feel that there's a cosmetic benefit, either to removing the breast completely and then doing a reconstruction, and some of it is fear, just looking at it as an abundance of caution.
Yeah, I totally agree with that. In fact, I just had a patient go through this, and she just wanted to be done with it. Yeah. She knew all the statistics. She didn't want it hanging over her head like a sword of Damocles. And it wasn't even the cosmetic effect. I mean, sometimes if you have one breast that's reconstructed and another one that's the original breast, then it can be asymmetrical. So you just want to do both and have it be a better cosmetic result. But that wasn't even this. The reason with my patient, the patient just wanted to be done with it, didn't want to hang over her head.
Well, have you ever wondered what texting might do to your spine? A study in Surgical Technology International measures the force on your neck based on how far your head tilts down. Looking at your phone at a 60-degree angle is the same as putting 60 pounds on your neck. Average Americans spend about an hour on their smartphone, and that may cause stress that could later require surgery.
There are 2 new food studies out of Johns Hopkins University. Researchers say people who have home-cooked meals eat healthier and consume fewer calories than those who don't. And people who cook at home 6 to 7 nights a week eat fewer calories when they do go out. In another study, researchers looked at school lunches for kindergartners through second graders. Nearly 6 in 10 kids put a vegetable on their tray in the lunch line, but only 1/4 of them actually took a bite of that vegetable. I think they studied me in this. Holly, you look at the results of these studies, I think it's pretty clear what we should be doing as parents, right?
Right. Well, you know, if only it were so clear. I mean, I feel as though I should put a camera in so everyone can witness the broccoli wars that go on in my house with my 3- and 5-year-old little girls. But, you know, these studies really emphasize 2 things. Number one, the importance of eating at home. Kids mirror what they eat at home with what they, you know, when they go outside and they eat outside of the home. And the other thing is the school cafeteria environment. I thought this was very interesting. Kids were more likely to take that bite of a vegetable if the cafeteria was quieter and less chaotic, or if a teacher was sitting at the table with them. But the biggest thing is just not to give up. You know, try and get that 1 bite in, because even that matters.
You know I'm fighting the same battle,
Yeah.
so I feel your pain. Well, finally, a growing body of evidence suggests that the happiest part of our lives begins in our 50s. It's called a U-curve. So what is this curve?
There is a fascinating article. It's written in the cover story in The Atlantic by Jonathan Rauch, and it talks about how happiness starts to go down like in your 20s and your 30s. It kind of dips down, reaches the bottom in your 40s, maybe early 50s, and starts to come out again. And it's a long article, very interesting about maybe all the different reasons. And when you're in that middle area, the bottom of the U-curve, you're in the thick of it. You have a lot of pressures. Maybe you're in the sandwich generation. You're taking care of kids and parents. And then as you start to come out of it, you get a little bit of wisdom. You start to appreciate the moment a little bit. I mean, my mother used to talk to me about appreciating every little bit. She would peel an orange and she would say, at this moment, this orange has never seen the light of day. And then she would peel it. That moment, appreciate it. Now, you're more likely to appreciate it later. And I have to say that it's just a statistical analysis, so it doesn't apply to everybody. I know you're happy all the time. Everybody at this
No,
table
it was
is always
interesting
happy.
because when I turned 50, and I was rather grumpy that day, and talked to my mother who was in her 70s, she looked at me and she said, my 50s were my favorite decade. And it took me about 6 years to understand why. But now I do. It makes sense. So, Holly, the peak of emotional life may not occur well into your 7th decade, though, right? So what exactly happens when you get older?
Well, you know, I think we do get smarter. You know, basically, as the horizons grow shorter, we start to focus on what science has long shown us makes us happy, whether it's meaningful relationships, whether it's putting less pressure on ourselves, whether it is appreciating that very present moment, like John's mother peeling the orange, just appreciating the moment. These are all things that we know make us happy, but we're not wise enough or able enough to do it until we start to get older. But we're all going to start right today.
I'm going to appreciate an orange, that's for sure.
There you go.
And appreciating your health.
It's true. That's the most important part. Dr. Holly Phillips, Dr. Jon LaPook, thanks so much for being with us this morning.